Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness and muscle medicine and much more. I touch on treating the body at the cellular level, cellular nutrition and fitness, cellular medicine. Of course, I also talk about peptides, hormone optimization, all these things. So today's a little quick one talking about one of my favorite subjects that we could talk about a lot, of course, body composition. So peptides and body composition, right? We want to talk about muscle gain and fat loss. We want to put on muscle, burn the fat, right? I've done some videos before on this, and I'll touch on a few more things which I'll dig into in future videos, and you can look at some of my older videos on YouTube that I did last year on some of these other peptides in more detail. We focus, of course, on testosterone and growth hormone and different things like this, but sometimes there's some unsung heroes, right? And those are kind of the ones I want to talk about. One of the first ones, of course, is TA1 or Thymus Alpha 1. People are thinking, wait a minute, what's that have to do with body composition? That's for immune system, right? Well, yeah, it does, but a lot of my patients actually start out with Thymus Alpha because it just does so many things. It's such an amazing peptide, and it's extremely safe, very selective, and it can start off the proper processes. Sometimes you have to, again, it's not cookbook medicine, is why you need to see someone who knows what they're doing, because if you start throwing all these things at it and your body's inflamed, you have a metabolic disorder, a deficiency somewhere, something else is out of whack, you got some abnormal cellular senescence, you can actually make things worse and hurt yourself. So you don't want to do that. So oftentimes when people are inflamed, they've got some abnormal other issues going on in their metabolism or deficiencies or immune system dysregulation or a myriad of other things. Sometimes a Thymus Alpha is a great place to start because it'll put those things in check and fix that first. Oftentimes we have to address the cell, right? We have to address the inflammation and the immune system first, and then we can start addressing things like the mitochondria, then start building up on that and fixing things, and then worry about building muscle and burning off the fat. Sometimes there's some underlying things that you have to correct first. So sometimes it's about reducing inflammation, getting the body functioning properly at the cellular level first. So that's why I'll throw in some things up. Some of my patients ask me, like, why do you have me on ketones or Alka-Seltzer Gold and thymosin? Why I want to lose weight. I'm like, we're going to get there. It's a stepwise process. So Thymus Alpha is a great one for overall many things. And again, sometimes it's a great place to start and to keep the body in check and to help with recovery, keeping your body healthy and strong so you can recover from your workouts. Same with BPC. BPC is an awesome recovery peptide. Again, extremely safe, helps your body to recover and bounce back, heal from injuries, heal the gut, much more. A lot of patients that I work with, they're big into fitness and training. They're athletes or training for Olympics and things like this. And recovery is huge. As we all know about, well, a lot of us, everybody likes to go, but sometimes you have to recover even harder. And sometimes it's hard for my high flying people to really do this, to get them to take the brakes, take the foot off the gas pedal. So these are some things that can help with speeding up that recovery process to reduce muscle soreness, reduce the risk of injury, get you back in the gym, back on the track, the court, etc., a little bit faster. So BPC is another great one for boosting recovery, maintaining that optimal function for fitness or sports or whatever that might be, and boosting performance, which of course is going to help you perform better and therefore put on more muscle, burn off more fat. Of course, the GHRHs, GHRPs, these are the growth hormone secretagogues. This is the whole topic in and of itself. Amazing for overall health, quote unquote anti-aging, which I hate that word because it's not, you can't really stop aging, but we can improve it, make the body function better. And there's not more effects than just the growth hormone, right? There it has what's called pleiotropic effects on the body. There's receptors for these hormones, these peptides, all throughout the body that has independent actions separately just from the growth hormone effect. So improving bones, making them stronger, improving muscle function, preserving muscle, and actually can help with muscle gain and certainly helping with body composition in terms of burning fat, recovery, healing, bouncing back from injuries, sleeping better, and much more. It's about protecting the cell, keeping it functioning optimally, keeping things functioning well at the cellular level. And again, I'll talk about this in a future video, but again, this is more of a foundational peptide once these other things that I talked about earlier are corrected. So, and of course, over a period of months, it will definitely help with body composition. But these are all the heavy hitters. Some things I want to talk about that are a little bit unsung, right? Things that people kind of forgotten about. Thanks to one of my colleagues, Dr. Yurth, for bringing this up. Is it's actually been around for a long time, used in other categories, but oxytocin is kind of the hidden one. I think we're going to start hearing more about it. That some studies have shown that it actually can help with muscle gain and fat loss, and it's very safe, right? And so this is the connection, is like some of these older anabolics, where some of the thoughts were maybe this is how they work, because they show that they boosted oxytocin massively, triple digit growth in oxytocin. Maybe that might be how it worked, because oxytocin, of course, the feel-good hormone, it can help with emotions, with mood. Of course, that's what happens after sex and with breastfeeding and things of this nature. That hormone that makes you feel good and feel relaxed. It helps with serotonin, some of the other neurotransmitters to, again, make and be useful for people perhaps need to settle down and relax before giving a speech, or they just need to be more social if they're afraid of going outside, or just people that just socially awkward, that kind of thing, can kind of put people in a better state of mind and emotionally more connected, make them able to interact with other people. So that's another use of it as well. And of course, but again, it's starting to be recognized that this might be a potent medication to actually help post-workout, and you can use it daily or post-workout, or both, for better sleep, for better mood, and of course for helping with muscle gain and fat loss. So this is something I just started trying myself. I try it on a few of my clients and patients as well, but extremely safe, not really been found to have too many abnormal side effects, and it doses vary quite a bit. So reach out to me if you want to talk to me offline about this, but this is kind of again, it's been around for decades, but we're kind of rediscovering the fact that it's kind of got hidden use, right? So some other ones I've talked about in future ones are Mod-SC and 5-amino-1-MQ, function more at the cellular level, improving mitochondrial function and mitochondrial efficiency, can definitely help with performance, insulin sensitivity, and some studies have indicated some improvement in body composition as well. A little harder to get nowadays, unfortunately, but all these are available. But these are some really cool peptides that, again, we don't talk about very much, and I just want to get that out there. So if you have questions, reach out to me, like this post, share it, and let me know if there's anything else you want me to talk about or dig into. I will talk about that. Reach out to me if you want to do a consultation for anything related to longevity, hormonal optimization, peptide therapy, and more. And also my partner and I, Ellie Gilbert, have an awesome 1-2 punch dual combo consult where we hit everything: fitness, nutrition, peptides, hormones, and much, much more. So reach out, and everyone have a great weekend. We'll talk to you soon.